Hello everyone. Now we are going to discuss one important question. It will help in skill based exam also. Question is, while doing ECG, V2 electrode is placed in. So while doing VCG, where we will keep the V2 electrode, like that in question is asking. Options: fourth intercostal space just to the right of the sternum, fourth intercostal space just to the left of the sternum, fifth intercostal in mid clavicular region, second intercostal just to the left of the sternum. So mainly the given the options placement where we will keep the V2 electrodes. Option B is correct. Fourth intercostal, fourth intercostal just to the left of the sternum. So what is mean by ECG? ECG is a diagnostic procedure done for heart diseases. So to diagnose, to identify the heart diseases, we will do the ECG. So ECG is electrocardiogram. We ECG, if we are going to expand, it is electrocardiogram. It will help in the diagnostic procedures of heart diseases. It is the standard procedure. 12 leads ECG will be shown, like structural changes. If any structural changes like aorta, it is going to be placement in the right side. If it is going to pulmonary arteries, pulmonary veins, placement will be in the left side. So like that structural changes also it will be shown. Conduction disorders, like conduction disorder, hypertrophy, if heart is going to be hypertrophied, so ECG will be like this. So some variations will be there. So damages, ischemic, MI, like that, some MI ischemic infarction changes also it can be seen. Electrolyte imbalance, hypokalemia, hyperkalemia, hypocalcemia, like that all electrolyte imbalances also will be seen. Drug toxicity, like uh, digoxin toxicity, lithium toxicity. So if any medicine will be high, above the therapeutic range, this ECG will be in a different changes will be seen. So and also helps in the assessment of the arrhythmias, like VT, VF. These all changes we can see with the 12-lead ECG. So in this what they are asking the question, so where we will keep the V2 electrode. So we have two types of electrodes, bipolar limb electrodes and unipolar electrodes will be there in the ECG. So you first bipolar electrodes means any lead that consists one electrode on one side of the body and another is at the another side of the body. That means like this. So limb leads, these are called limb leads. So here positive charge will be there in one lead place, and another limb like legs will be there, no? So here the negative charge will be there. So this having two poles, that's why we will call as a bipolar limb leads. So in this another leads like that chest, unipolar chest leads will be there. So here unipolar is we will be will be placing in chest. On the chest we will be keeping uh, only one place. This will be called in unipolar chest or V leads. Active electrodes are placed over the 6 places over the chest. So these are the in this placement only question asked. So I will show one image. So this is the image. In this image in this image the placement of the electrodes will be seen. So in this V1 is fourth intercostal space. Intercostal space is nothing but between the ribs. Fourth and fifth ribs, in between the space will be there na. There we have to keep right side of the chest. In the fourth intercostal space we have to keep V1. V2 is exactly left side of the fourth intercostal space. Fourth intercostal space means between the fourth rib and fifth rib, the space will be there na. So just to the left of the sternum, fourth intercostal space, we have to keep the V2 lead. Then coming to the third lead is between the fourth rib and second rib and fourth rib. So placement, though where we have to keep the fourth lead means so this is the mid clavicular line. This is the collarbone or the beauty bone or the clavicular bone. So here on the mid clavicular line we have to keep at the fifth intercostal space, we have to keep this V4 lead. So then coming to the V5 and V6. V5 we have to keep the anterior axillary line here. This is the axillary area. So anterior to the axillary area at the fifth intercostal space. This will be fourth, fifth will be, sixth will be in the fifth intercostal space itself. So where we have to keep the fifth intercostal space, fifth lead means anterior axillary line. So then coming to the V6, it is the mid axillary line. Here we will be having the axilla. So on the straight mid axillary line at the fifth intercostal space, we have to keep this V6 lead. This is the placement, very important for the skill based exam also. These are the unipolar chest leads. We have to keep V1, V2, V3, V4, V5, 6 in the chest area to identify the many heart diseases. So unipolar V1 is the fourth intercostal right of the sternum. V2 is the fourth intercostal left of the sternal border. V3 is between the V2 and V4. V4 is fifth intercostal space mid clavicular line. V5 is fifth intercostal space left axillary anterior axillary line. V6 is the fifth intercostal space left mid axillary line. So in this mainly why they ask the V2 means same to same, right and left difference will be there. So they, to confuse us, they will ask where V2 will be kept. So we will think without seeing the right, we will keep the fourth intercostal space right sternal border. So we have to concentrate, V2 will be kept at the left side itself. Okay, this is the answer. Thank you.